Barack Obama during the campaign, and he spoke about it when he accepted the Democratic nomination for president.
Now is the time to finally keep the promise of affordable, accessible health care for every single American. If you have health care, my plan will lower your premiums. If you don't, you'll be able to get the same kind of coverage that members of Congress give themselves. I will end this war in Iraq responsibly and finish the fight against al-Qaeda and the Taliban in Afghanistan. The change we need doesn't come from Washington. Change comes to Washington. Change happens because the American people demand it.
Jane Hamsher is the founder of FireDogLake.com. Jane, it's always a pleasure to speak with you.
Good to be here, Tamron.
So, you look at that speech, and at that time the president, or now president, had his plan in order, and the left was certainly the people in that crowd yelling and really passionate about what they were hearing. Got to tell you, this weekend I was sitting with someone who is a liberal who, had tears in his eyes, expressing to me what he felt was the disappointment that he's getting from this administration and this president this early on. What are you hearing from those on the left? Do they feel abandoned, or is this some media storyline that we got out there?
Well, I think that your friend very much speaks to how many people in the country are feeling who voted for Barack Obama, a strong majority who really wanted to see meaningful health care reform. During the campaign, Obama said that he was going to have broadcast on C-SPAN all of the negotiations with the insurance companies, pharma, all the stakeholders in this health care bill. And that didn't happen. He criticized Dick Cheney for holding secret meetings with energy officials, and then he refused to release the White House logs of who has come to the White House to negotiate on behalf of these stakeholders. On May 11th, stakeholder leaders came to the White House and presented proposals for reducing the rate of increases in health care costs over the next 10 years. And we know that there was a deal done with pharma and a deal done with the hospitals, but we don't know the details of all those deals. And I think people really want the White House to release the details of those secret deals that have been made, so we can know how they're going to affect our ability to control costs over the coming decade.
And I think in addition to the things you've just pointed out, what I'm also hearing from people is that they feel that during the Bush years, you saw this support from his base, and he delivered to his base, whether others disagreed or not. And you have these people who supported President Obama feeling that, where is that? We've got the power now. We control Congress, and we've got the men we wanted in the White House, but they are busy trying to move to the center rather than satisfy some of the promises made early on to the base.
Well, I'll say it's not even to the center, Tamron. MoveOn did a poll last week and found that 77% of the country want to have access to a public plan. That's not the left. That's not the far left. That's where the country is. And now we've got a Democratic president in the White House who campaigned on this. We've got 60 votes in the Senate. We've got a House Speaker who promised that no bill would get through without a public plan. And we're being told that we have to accept less based on this deal done with the Finance Committee, which seems to be the deal that's dictating what happens.
Jane, what does all this do in terms of groups on the left who worked so hard a year ago, and your groups and followers? What happens next when the president says, okay, here's an issue, I need your help? What do you do at this point?
Well, I think in terms of health care, now we're asking 40 Democrats to stand together and to defeat any bill that doesn't have a public plan. Democrats from strong districts with big Democratic majorities. And 60 members of the House have signed a letter to Kathleen Sebelius saying that they won't support any bill that doesn't have a public plan. So they could, in effect, block a bill from going through. And even if they're having their arms twisted to just pass something. And I think that the White House thinks that they can get away with it, that they can sort of lipstick a pig that just raises insurance rates and makes everybody pay tribute to Blue Cross, essentially, and think that they can sell that based on, the president's power of persuasion. I think those are considerable, but I don't think they're going to work this time.
So interesting. Right. Jane Hamsher, thank you so much. We appreciate it. Jane Hamsher of Fire Dog Lake. And, you know, Tamron, we're starting to hear more and more of that, and that is Democrats on the left who say, you know what, if this reform amounts to transferring taxpayer money to the for-profit insurance companies so that they can continue their practices but just have more customers, that's not going to fly. Right. And the president is going to be in a pickle if, in fact, they are able to get those 40 to 50 Democrats in the House who say we're not going to go along with this.
September is going to be a very interesting month, David.
Absolutely.